A week ago, we first brought you the story of the forced transfer of a young cancer patient in the final hours of her life. She was approved for medical assistance in dying, or MAiD, but St. Paul's Hospital doesn't allow it because it's overseen by a Catholic-run health authority. The health minister is now in discussions with Providence Health about changing that policy, but a palliative care doctor is worried it won't go far enough. CTV's Shannon Patterson reports.
Dr. Jyoti Jayaraman has been a palliative care physician in Vancouver for more than 20 years. And when medical assistance in dying was approved in Canada in 2016, she became a MAiD practitioner.
One of the criteria for eligibility is intolerable suffering. So when a patient says, I'm ready to die, what you're saying is, I cannot suffer anymore.
But she says the policy at St. Paul's Hospital to transfer palliative care patients who've been approved for MAiD to other facilities in the final hours of their lives causes even more suffering.
I have borne witness to many of these transfers, and as have my colleagues.
Dr. Jayaraman is one of more than 160 local healthcare professionals who wrote to the Premier this spring asking him to stop the forced transfer of MAiD patients from facilities run by faith-based organizations like Providence Health, which oversees St. Paul's Hospital.
We really heard nothing back. It seemed as if our lived experience of witnessing forced transfers had no meaning at that point.
Then Sam O'Neill's story came to light. The 34-year-old terminal cancer patient had to be sedated for her transfer from St. Paul's to a hospice to undergo MAiD in April, and she didn't wake up to say goodbye to her loved ones.
Sam's situation captured, I think, the country. There is talk now in the country about how is this happening? Most people can't believe it's happening. Let me tell you that I have seen enough.
And it appears so has the provincial government. The health minister is now in discussions with Catholic-run Providence Healthcare about setting aside its religious objections and allowing MAiD on site at St. Paul's Hospital.
We're starting with St. Paul's because the circumstances in acute care are often different. You're really not choosing in acute care. When you go to acute care, you're not choosing at all. And so this is a good place to address things, and that's what we're working with Providence on.
Mr. Dix going to talk to Providence or to St. Paul's is one thing, but this is not a time for half measures. This is not a time to say, St. Paul's, will you allow it? And it's only because it's an acute care facility.
Jayaraman says long-term care and palliative care patients often have no choice about where they end up. And if the facility is affiliated with a religious group, they're also forced to move to undergo MAiD.
In long-term care, they have moved there sometimes 5-6 years ago. That is their home. They pay rent. It's recognized as their home. Why should they be moved out of their home?
She's advocating for an end to all forced transfers from public health care facilities, a fight she says has become a calling.
I think this is something that needs to be stopped, and I'm prepared to do whatever I can.
Shannon Patterson, CTV News, Vancouver.